indicated for the treatment of malignant hyperthermia in conjunction with appropriate supportive measures and for the prevention of malignant hyperthermia in patients at high risk. Important safety information. Ryanodex, dantrolene sodium for injectable suspension, is not a substitute for appropriate supportive measures in the treatment of malignant hyperthermia, MH, including discontinuing triggering anesthetic agents, increasing oxygen, managing the metabolic acidosis, instituting cooling when necessary, administering diuretics to prevent late kidney injury due to myoglobinuria. The amount of mannitol in Ryanodex is insufficient to maintain diuresis. Precautions should be taken when administering Ryanodex preoperatively for the prevention of malignant hyperthermia, including monitoring vital signs, avoiding known triggering agents, and monitoring for early clinical and metabolic signs of malignant hyperthermia that may indicate additional treatment is needed. The administration of dantrolene sodium is associated with loss of grip strength and weakness in the legs, as well as drowsiness, dizziness, dysphagia, dyspnea, and decreased inspiratory capacity. Patients should not be permitted to ambulate without assistance until they have normal strength and balance. Care must be taken to prevent extravasation of Ryanodex into the surrounding tissue due to the high pH of the reconstituted Ryanodex suspension and potential for tissue necrosis. In most cases, the loading dose of Ryanodex can be reconstituted and administered in less than 1 minute. When malignant hyperthermia, or MH, has been diagnosed, it's important to treat it immediately. MH is characterized by the uncontrolled release of calcium from the sarcoplasmic reticulum into the myoplasm. The signs of MH include truncal and/or masseter muscle rigidity, increasing end tidal CO2, tachycardia, high body temperature, acidosis, rhabdomyolysis, hypercarbia, and hyperkalemia. 1 vial of Ryanodex has an mHouse recommended loading dose of 2.5 milligrams per kilogram for a patient up to 100 kilograms, and a labeled dose range of 1 to 10 milligrams per kilogram, with a maximum cumulative dose of 10 milligrams per kilogram. Ryanodex is reconstituted quickly and easily by injecting 5 milliliters of sterile water to the 250 milligram vial. Agitate the vial until the medication is mixed thoroughly, which should take no more than 10 seconds. The suspension should be a uniform orange color. Draw the reconstituted suspension into the syringe based on a 2.5 milligrams per kilogram dose, then administer Ryanodex by rapid intravenous push to the patient in crisis. For example, for a 70 kilogram patient, the loading dose would only include 3.5 milliliters of Ryanodex, 175 milligrams of dantrolene sodium. Ryanodex should be administered by continuous rapid intravenous push. Ryanodex can be administered either by injecting Ryanodex into the tubing of an IV line or through a connector with a luer-lock syringe. 1 vial of Ryanodex provides enough medication for a 2.5 milligrams per kilogram loading dose in patients up to 100 kilograms. However, additional doses may be necessary to reverse the MH crisis. If you suspect that you are dealing with an MH event, mHouse maintains a 24-hour hotline staffed by experienced and MH-knowledgeable anesthesiologists. The phone number for the hotline is 800-644-9737. Ryanodex is a dantrolene sodium formulation that can be reconstituted and administered in less than 1 minute. For more information about administering Ryanodex, call customer service at 855-318-2170.